The circulatory system. The circulatory system is a transportation system by which oxygen and nutrients reach the body cells and waste materials are carried away. It also carries substances called hormones, which control body processes, and antibodies to fight invading germs. So, our heart is like a size of our fist. It is a thick muscular walls and is divided into two pumps. Each pump has two chambers, the upper chamber and the lower chamber. The upper chamber is the atrium, which receives blood coming in from the veins, and the lower chamber is the ventricle that squeezes blood out into the arteries. Another part of circulatory system is the blood, which it functions as it pumps by our heart and it travels through thousands of miles of blood vessels. It carries nutrients, water, oxygen, and waste products to and from your body cells. It is made up of liquid, solid, and small amounts of oxygen and carbon dioxide. So our red blood cells carry oxygen from the lungs to all the cells of the body. It takes carbon dioxide and transports it back to the lungs. About 5 million red blood cells in one drop of blood. So white blood cells also, if red blood cells carry oxygen, white blood cells protects the body from germs. It attack and destroy germs when they enter the body. And then we have also the blood vessels, which it is a hollow tubes that circulate your blood. There are three kinds of blood vessels. We have arteries, the veins, and the capillaries. So blood from artery, it exchange of gases, nutrients, and other materials. The blood from the artery will go to the vein. And we have also three kinds of circulation: the pulmonary circulation, the coronary circulation, and the systemic circulation. The pulmonary circulation is the movement of blood from the heart to the lungs and back to the heart again, while the coronary circulation is the movement of blood through the tissues of the heart. Lastly, we have the systemic circulation, where it supplies nourishment to all of the tissue located throughout the body except for the heart and the lungs, since pulmonary ang responsible para ana. So we are done with the parts and function of the circulatory system. Let's move on to the common diseases in circulatory system. So we have anemia, leukemia, coronary artery disease, hypertension, valvular heart disease, and myocardial infarction. So when we say anemia, this is it is a condition that do not have healthy RBC or red blood cells. So anemia is a condition wherein kulang ka or hindi sapat ang healthy red blood cells. So anemia has an inadequate oxygen supply sa ating mga tissue, kaya persons that are anemic can feel fatigue, pain, pale skin, irregular heartbeat, chest pain, dizziness, cold feet and hands, at headaches. One cause of anemia ay yung iron deficiency, kaya para maiwasan ang anemia, we should eat food rich in iron like chicken, liver, broccoli, pork, beef, egg yolk, clams, shrimp, watermelon, watermelon, spinach, and many more. Second disease is the leukemia, which it is a cancer of the bone marrow that produces the white blood cells. So when or the WBC. So when we say cancer, this is a one kind of cell, isang uri ng cell na nagkakaroon ng cancer. Nagiging uncontrollable ang kanyang production, kaya ang white blood cells ay mas dumadami kaysa sa RBC. As of now, there is no known cure for leukemia, at ang isang pasyente na may leukemia ay maaring mamatay within weeks or months. So, ang normal blood, marami siyang red blood cells or RBCs. Pag may leukemia, ang tao, dominant sa kanya yung white blood cells compared to red blood cells. So, persons with leukemia can feel fever, weakness, frequent infections, weight loss, easy bleeding, at bone pain. Kahit wala pang perfect cure para sa cancer, pwedeng magkaroon ng treatments ang mga cancer patients. So, when we say treatment, this means pwedeng mawala ang tumor cells, pero nandyan pa rin ang possibility na lumaki sila at bumalik. One way to treat this kind of disease is through chemotherapy. So when we say chemotherapy, this is a treatment wherein kung saan chemo drugs ang dumadaloy sa bloodstream para pumunta sa cancer cells. So why do patients or cancer patients go bald or nagiging bald sila? Hindi cancer ang dahilan kung bakit nakakalbo ang mga cancer patients. The reason for this is the chemotherapy. Nagkakaroon ng hair loss or baldness ang isang taong nagkaroon ng chemotherapy because this treatment targets all rapidly dividing cells. Kasama na dito ang mga cancer cells at ang mga healthy cells na rapidly dividing cells. Kasama na dito kagaya ng mga hair follicles sa ating ulo. Then we have the next disease, the coronary artery disease. It is caused by the narrowing of one or more coronary artery. So sa madaling salita, coronary heart disease is ang pagsikip ng coronary arteries. When you say coronary artery disease, it is caused by atherosclerosis. Atherosclerosis is the thickening of the lining of an artery. So, kumakapal ito dahil sa build-up ng cholesterol at other materials we called plaque. So, dahil dito, ang ating heart ay hindi nakakapagkuha ng sapat na oxygen na maaring magdulot ng chest pain o heart attack. Next is we have the hypertension or high blood pressure. This is commonly known as the silent killer. This kind of disease increases the risk of heart disease, stroke, and sometimes death. So, bakit siya tinawag na silent killer? It's because person with hypertension may feel normal, but actually the high blood pressure will cause harm by increasing the workload of the heart and blood vessels, making them work harder and less efficient. So, a person with hypertensive or hypertension has a high risk or chance to have a heart disease. We uses sphygmomanometer to measure our blood pressure. The normal blood pressure ranges less than 120 to 80. So, ang 120 dyan ay tinatawag na systolic pressure, and the 80 is the diastolic pressure. So, 130 above na blood pressure is high na yan siya. So, ang 130 to 139 and 80 to 89 diastolic pressure is, ang tawag sa kanya is stage 1. Habang ang 140 to 90 is stage 2, and ang 180 above and 120 above, yun na yung mga hypertensive crisis that can cause stroke. Next, we have the myocardial infarction. It is a heart attack caused by blood clot that prevents blood flow to the heart. So, kapag wala ng oxygen supply ang ating heart, ito ay pumapalya. Ang symptoms ng heart attack ay tightness in the center of chest, shortness of breath, dizziness, and weakness, irregular heartbeat, and sweating. Then we have the last common disease in circulatory system is the valvular heart disease. It is a damage in one of the 4 heart valves. So, valvular heart disease harden the valves and prevent them in a proper blood flow. So, ito ay may kinalaman sa valves ng ating puso. When we say valves, those are mga na nag-control sa flow of blood between the atria and the ventricles. They prevent the backward flow of blood para maging smooth ang flow ng blood sa ating heart. And we have the 2 types of valvular heart disease, the stenosis and the regurgitation. So, when we say stenosis, it is a valve na normally open that doesn't open properly. Kaya hindi nakaka-flow ang dugo mula sa heart. Whereas ang regurgitation, it is a valve na normally closed that doesn't close properly. Kaya nagkakaroon ng backward flow or ng backward leak sa heart. Kapag ang isang tao ay magkaroon ng valvular heart disease, nakakaramdam siya ng shortness of breath, swelling effect, then palpitations, fatigue, and rapid weight loss.